Okay, give us just a sec. So recording now. Brilliant. Thank you, Sandra. So next slide, thank you. So if you could just say in the chat, it would be lovely if you could just introduce yourself in the chat. So say your name or write your name and your role, the organisation you work in, and just briefly say what you want to get out of the community of practice. So if we can just spend just a minute or two doing that, please, that'd be great to understand what organisations you're in, what roles you're in, who you are, and what you want to get out of this community of practice. So just waiting for that to come through on the chat. So I can see people are typing away. As we said, this is about getting bid ready. So really thinking about, as you say, what you want to get out of this community of practice from the perspective of getting bid ready so that it gives Joe a chance to be able to consider the points that you've raised and include those where possible. And if we can't, what we'll do is we'll take that away and we'll just make sure that we get back to you. Thank you to Alex. Top tips on bid preparation. So this is about getting bid ready. This is a bite-sized piece, but Alex, I think we're going to be covering that for you. Learning more about bid writing. Lovely to meet Alex from Primary Care Development Lead for Pharmacy. Fantastic at Dorset Healthcare. Joe, hopefully you're able to have a look at these as well as they're coming in. It's fantastic. Bid preparation for projects, top tips and tricks for bidding from Lisa Andrews at the AECC. Lisa, it's lovely that you're joining us today, and I'm sure we'll get some top tips through for folk as well. Okay, if we can go to the next slide, please, that'd be lovely. Let's get us moving. So just very briefly, as you've heard, I'm the lead for the Dorset Innovation Hub, and if you're not aware of the Dorset Innovation Hub, just really briefly, we are a place-based, we can go back one, Sandra, if that's all right, place-based system partnership, working with all partners within, we're having great fun with technology. I do apologise about this. We're a place-based system partnership working with all the partners across Dorset. As you can see here, it's our local authorities, the 3 academic institutions, coming through to the acutes community and the voluntary and community sector assembly, as well as newer members, our Dorset Police as well. And we also have supporting partners. So that's, for example, the NIHR ARC, so that's the National Institute for Health Research, Applied Research Collaboration, and also the Health Innovation Wessex and Wessex Health Partners, as well as individuals or individual organisations like the Comprehensive Research Network. So a system working together, taking forward innovation and actually using those collective skills and expertise to be able to take forward innovation in a constructive and positive way, in a successful way. Next slide, please. And just really briefly to introduce you to members of the Innovation Hub, and I can see several members are on the community of practice today. We have our programme group, which is the overarching voting members of organisations, and you can see on that top screenshot there. So that's representatives from the partner organisations that oversee the development of the programme priority projects and oversee and receive those risks and mitigating factors for projects. And then at the bottom you've got our core team, so we provide facilitative support. So I can't see at the moment because we've got the screens, but if you just type in the chat who you are from the core team, that would be fabulous as well, so we can see that. Facilitative advice and support is provided by the core team members working within the organisations, for the organisations and for the Dorset system, providing support for priority projects and working with the project sponsor and the clinical teams. And that's the key. We work with individuals to support rather than just helicoptering in and doing. And that actually means that innovation adoption is more successful. There's also support provided for the education programme and benefits realisation, for example, so strategic pieces that we're working on together. Next slide, please. So today we invited you to join us to understand a little bit more about getting bid ready. And there's some key points about key generic supporting documentation, including a checklist, and how the inward investment teams provide support with potential opportunities. So next slide, please. So without further ado, going to hand over to Jo. Jo, over to you. Thank you.
Hello, thank you. Yeah, I apologise to everyone if my voice is a bit croaky. I did a bit of shouting at the telly last night. I don't know if anyone else did the same. So as I mentioned earlier, I'm Jo. I work as a bid manager for NHS Dorset. Predominantly, my role involves working on the processes involved with funding applications and development and supporting people within the ICS with their applications. So this means that technically I'm regarded as a subject matter expert, and that's why I've been invited along today to share my insights on how to get bid ready. Next slide, please, Sandra. So firstly, to understand the funder requirements, we have the big idea. So funding can come at any time in all shapes and sizes. Some pots will be vast and some of them will be for small amounts of money. You can have very complex applications that require a lot of detailed information. And then there may be others that only have a few simple questions as part of the application process. But being prepared will be a vital part of a successful bid application. So whilst you may not know exactly what format it will come in, you can assume that as a general rule, most applications will expect the following key pieces of information. And that will be what your project title is, an overview, so what it is that you want to do, why does it need to happen, how the project will be delivered, how much money your project is going to cost, what type of money you're going to need, which will it be capital, revenue, or both? What will the benefit or the impact of the project be and how are you going to measure that? What's the potential risks to the delivery and how are you going to mitigate them? How will the project be sustained after the funding period is a key question that's asked. So if every project and work stream is approached with the answers to those questions in mind, there should be enough information on hand to be able to populate most or all bid applications that you will come across. Next slide, please, Sandra. But having that information prepared is one key part of getting bid ready, but it's not the only part. You must also understand the bigger picture from both the funder's perspective and the organisation's. Before you invest too much time in writing your application, it's always advisable to read the guidance thoroughly, because it should give you key information on what the key objectives of the funder are. So what is the problem that the funder is trying to solve? And are you eligible to apply for it? So for example, is the funding reliant on an ICB, a charity, or local authority involvement?
Jo, I'm really sorry to interrupt your train of thought, but can I just double check? Would you like the previous slide up, which is part
the
two?
Previous one. Part two, the big picture. Yes, please.
Yeah, will do.
Sorry, I didn't even notice we were on the wrong slide.
No worries. There you go.
Okay, so obviously they're checking if you're eligible to apply. So in the early stages, it might appear that your project is the perfect fit for the funding call, or alternatively, it might seem that it doesn't align at all with what the funder is asking for. You should not assume that either of those is the case. So although it might be laborious, checking the detail within the guidance and the eligibility documentation to answer those points is important. And if you need to, should contact the funder to clarify. You also need to think about what the expectations are from the funder for holding and spending the money. Again, what type of money is it on offer? Is it capital or revenue? Who is the money going to pass to if you're working in partnership or collaboration with people? How will they distribute the money? So is it going to come in one lump sum? Is it going to be over financial years, or is it going to be through an invoicing process? And when you consider that from an organisational viewpoint, you need to understand that every bid you apply for will need approval from your organisation's governance board in some form or the other. So therefore, it's important from your organisation's perspective to understand if they are able to meet the funder's requirements in terms of holding and spending the money. So, for example, if the funder pays the money out in one lump sum and that funding runs over 2 financial periods, is your organisation going to be able to carry the funds across into 2 different financial years? So to answer this, the financial lead of your organisation will be key. They should know the answers. So you need to find out who they are and make sure that they have oversight of the funding at the appropriate time. You will also need to understand what your organisation's strategic objectives and priorities are, and if the funding call aligns to those. Because even the best ideas will need to align with the organisation's priorities, and the bid will need to demonstrate that it does. Because if it doesn't, it's unlikely to get the required approval from the necessary people in your organisation. So therefore, don't invest too much time if you're not going to get the sign off anyway. Next slide, please. So to get bid ready, you also need to think about your stakeholders. And to clarify, a stakeholder is anyone who is impacted by, interested in, or can influence the project. And they're a critical part of bid development. They need to have input, because if you work in isolation and you don't have the right level of involvement from your stakeholders, you could miss key information that's relevant to the bid. You can fail to get the appropriate buy-in from the key people and partners. You could misallocate roles and responsibilities in terms of developing the bids. You could miss key bid reviews and sign-off requirements. And you could just promise something that can't be delivered, which could be for lots of reasons, such as capacity, governance, financial commitment, or many other reasons. And all of those can impact the success of a bid. So you need to get the right people involved with your bid at the right time. You need to identify and engage with them as early as you can in the process. And some of those stakeholders will be obvious, like a particular program lead or a clinical specialist in your organisation. But some stakeholders might not be so obvious, like the finance lead or the clinical safety lead or the procurement lead, for example. And to give you an example of this in context, recently we have been supporting a bid application for the British Heart Foundation. And the premise of the bid was to expand on a pilot which was utilising 2 different types of Holter monitors, which was measuring and detecting heart palpitations over a period of time. The pilot was working well, and the team wanted to use funding to roll that out into GP practices to support earlier diagnosis and relieve the pressure on arrhythmia clinics. So after the initial kickoff meeting, it became clear that not all the relevant stakeholders were around the table. So there were a lot of key ones there: the cardiology team, the CVD leads, the acute hospital partners, so health inequality leads, and other people generally interested. But because the idea of it involved purchasing monitoring devices, it would require the involvement of the procurement team and the clinical safety team as a minimum. They would be critical during the funding application to make sure that the right processes and protocols were being followed and considered, and that the bid could be costed effectively. So they weren't there. We realised they weren't there because we started engaging with the known stakeholders as early as possible. So we recognised the people that were missing quite early in the process and were able to engage with them to resolve the issue. But that could so easily have been missed and would have become a much bigger problem as the application drew closer to the deadline. So the simple message here is get as many stakeholders as you can think of around the table at the start of the development of your bid, and have a conversation about if they're the right people to be involved and who is missing. There are a lot of tools and resources that can help you identify who your stakeholders are, and we've put some links to those at the end of this presentation. But if you are ever in doubt, ask and ask again, and keep on asking throughout the bid development. is the key people that we need here. And yeah, so once you've identified your stakeholders, how much you engage or communicate with them is dependent on what their importance or influence is in the project and how much contribution to the development of the bid is required from them. Next slide, please. Right, so we've talked through some of the key parts of bid development. I'd like to explore how this could apply in practice. So this slide shows a real example of a funding stream that was released through NHS England through their Core 20 Plus Connector programme. So the programme funds integrated care systems and place-based initiatives to recruit, mobilise and support influential connectors to take practical action to improve health and reduce inequalities within the 5 clinical priority areas. The Connectors programme builds on best practice and evidence for community-centred initiatives and the experience of volunteer roles which impact on health improvement and inequalities. So, for example, community champions, vaccine champions, link workers, peer advocates, and salaried roles like social prescribing link workers. Core 20 Plus connectors play a role that contributes to improvement trajectories at ICS or place-based level and influence a reduction in health inequalities across other locally identified priorities. So the other key points of this, that's an overview of it. The other key points of the funding was that the value of this fund is for 50k for a year. The application process opened in April 2024. The deadline for the application was May 2024. There had been 4 previous rounds of funding allocated to ICBs across England, and this expression of interest for Wave 5 was open to all ICBs who had not previously been awarded funding. So based on this information only, what do you think? I'm going to put this out to the group. What do you think are the key points for consideration for application development? So if we could just spend a few minutes now sharing our thoughts on this as a group, or please do put your thoughts in the chat.
Are you happy for hands up, or are you happy for
hands up? Yeah,
talk? Yeah. People are thinking at the moment about the question you've asked them. Did you want to explore through it a little bit more, Jo, perhaps? I can't see any hands raised at the moment.
Okay, so some responses, some things you might be thinking about, some of the questions that would come up is it capital or revenue funding? What is the problem that the Core 20 Plus programme is trying to solve? So it could be things like that you're thinking of. What would be, what's the idea that you may have? Does it align to what they're actually asking for? So it could all be things like that you would need to think about. Yeah, absolutely. Eligibility considerations. So that behind this is a kind of just an overview of what the funding is. There would be guidance behind this, attached to this, which you would obviously have access to, and that should give you the answers to whether you would be eligible to apply, whether it would involve partnership working. Yeah, absolutely. That you have to give the consideration is, I mean, we kind of get a little bit of an ethos of there's a pot of money, let's just go and grab it and go and get it. But you have to be realistic about whether that can feasibly be done in the timescale that you've been given, and even if it's the right thing to do to take an amount of money that you know can't achieve what you need it to achieve. Yeah. all great points. So we've got the application time frame. It's quite a short turnaround, so you need to think about that as well.
It's interesting with the collaboration opportunities being said as well in the chat, and then thinking about potential stakeholders.
Mm-hmm. With something like this, it could be a whole spectrum of stakeholders to consider that you might not be obvious to begin with.
Yeah.
So this, you may all be finding this all a little bit confusing. But don't worry, because you're not the only ones. This brief was deliberately vague, and the people that specifically worked on this brief had to do a lot of unpicking before they decided to proceed with this application. I think they wanted to get a very broad range of, because this was the 5th stream of funding, they wanted to kind of open it up to maybe ideas that hadn't previously been explored.
Yeah, you'd think with less text that it actually makes it easier, but it doesn't. Devil's in the detail, isn't it?
It is, and that very maybe I've lost my slide, sorry. So that brings me on to the point that there was actually a hidden point to this. So whilst all those questions are important for consideration, there was a hidden point, like I said. Let me just get to the right place. That we did need to answer all those questions. They're important and they're part of getting bid ready, but this exercise is also aimed at pointing out the not so obvious aspects of getting bid ready, and that's the finer details that are easily overlooked. So if there wasn't already enough to remember, next slide please, Sandra. Before, during and after the bid application, you should consider and be aware of and understand the detail about the funding stream. So it's the little things that they don't say in the guidance, but the things that can blindside you if you're not prepared for them. And trust me, this is the inward investments bread and butter, and all of the things that I'm about to talk about could so easily have caught us out on bids that we've worked on. So is the bid application and relevant documents held in a shared platform, Teams, for example, so where all the stakeholders can easily access and contribute to them? What format does the application have to be submitted in? Is it Word? Is it PDF? Is it an online application? If it's an online application, have you registered for an account? If it's online, can you populate and save as you work through the application, or do you need to download and create a workable version? Does the website for the application close or lock on deadline day? And if it does, what time? Because being aware of that for many reasons, but one key reason is that if your application is complex or fiddly, then you need to allow yourself plenty of time to populate it. Because trying to manage the fiddly details whilst the clock is ticking is incredibly hard. So be prepared. Does the application allow for diagrams, tables or charts to be included? But especially if you're limited to a word count, they can be really useful tools to kind of articulate more of your idea without actually using words. Can the application include appendices and attachments? Who does the application need to be submitted by, and what level of detail is required about the applicant or joint applicant? So if what information is going to be needed about the senior responsible officer, the finance lead, and so on, and make sure you've got that information ready to put into the application. I've already touched on it, but is there a word count to the application? There have been many instances where we've written too many words, and that can be very stressful, trying to get to say a lot in 200 words. Have you allowed time to proofread or edit the document? Because I promise you, when you're given a strict word count, you will invariably have too many words at some point. You should always allow time to edit words and have someone on hand to edit those words for you. It can be very hard to cut your own words. And not only that, proofreading allows you time to make sure you have answered the question of the bid. It's really easy to go off on a tangent and think you're answering the point right, but you need to double check that, have I asked what they're specifically asking for in the question? You do also need to be aware of how many applications can be submitted per organisation. Is it, or ICS, is there one per ICS? Is there anyone else applying for the same funding pot? Because the last thing you want is to realise late in the day that you're competing against each other. It will either result in someone having to stand down and revoke their application, or it will involve both applications being weakened by each other and therefore unlikely to be successful. And again, that's something that we've experienced very recently, having to ask someone to stand down from an application. But the key message here is what they don't tell you is as important as what they do tell you. So if there are webinars or question and answer sessions about the fund, go to them because they can be really useful. Next slide, please. So the final consideration for getting bid ready is that not all bids will ask for great detail about the risks or benefits or the long-term objectives of your project, but they might ask for brief explanations about what these are. But most bids will ask about sustainability beyond the funding. And if they don't ask that, you should be thinking about it. What happens when the funding ends? Is the initiative, the service, pathway, workforce, or other resources just going to stop? Your answer to this will probably be no, because otherwise what's the point in doing it in the first place? So you need to think about and plan for how money is likely to be sourced beyond the funding period. And if this is through commissioning, you're going to have to at some point produce a business case. And that will include risks, assumptions, issues, and dependencies log to identify what the potential risks are of the project or what the potential risks are of not doing the project. A benefits log, so what the benefits are, when they will be achieved, how they will be achieved, how they will be measured, and what your starting point is. The potential options of how your project could be delivered in order to achieve the necessary outcomes, and how much your project is going to cost going forward, and what resources you will need, what contracts need to be put in place, etc. So whilst they might not be necessary for the bid application, it is always good practice to prepare and maintain those documents behind the scenes along with the bid application, because they will be needed for a business case, and you will need a business case for future funding. Next slide, please. Right, so the final slide for this section is a brief checklist. It's not an exhaustive list, but hopefully useful in jogging your memory when preparing a bid. So you need to make sure you read the guidance. You need to make sure you register to apply and attend as many Q&A sessions or webinars as possible. Create a shared platform that is accessible to all contributors. Create working documents for the application. Identify your stakeholders. Assign stakeholders with roles and responsibilities. Review the actions and application regularly to make sure it is on track. Make sure you are answering the question. Allow yourself and other key team members the time to review, edit, and sign off the application. Next slide, please. So that's in terms of the actual bid application. So now we're going to, in terms of finding funding opportunities, there's not a hard and fast rule. As mentioned in the previous slide, funding can come at any time and in all shapes and sizes and from many different funders. But there are some standard approaches that you may find useful in terms of looking for funding. And these include horizon scanning. It's the good old Google search. It can be a little bit like looking for a needle in a haystack. But if you have the time to search the web, you can usually find a few grants floating around in various places. It's worth noting, though, that they are usually for smaller pots of money and often don't offer capital funding. Well, from my experience anyway. I've included a link to a couple of these sites in the resource section at the end of this presentation. But our role in the inward investment team is that we do a fair amount of that horizon scanning anyway, either because we've been asked to or because we're just looking for a specific pot of money, or we're just trying to see what's out there. So if we come across anything useful, we log these in a funding database, and we generally send out expression of interest to emails to anybody we feel may be interested in pursuing the fund. So basically, before you invest your time in doing horizon scanning, it's always worth checking with us to see what we've come across. Then there's word of mouth and networking. That this can be very powerful and effective way of getting to know about funding that is available, because after all, people who are fully immersed in their chosen field will be well placed to hear about any potential plans to spend money or fund things. So keep your ear to the ground. You never know when something might come up, and also if there's an opportunity to attend a conference or a webinar or some other similar event, then go. Subject matter experts in one room can be extremely useful tool in learning about the pots of gold that may be at the end of the rainbow. Another way of being ahead of the game is simply by being aware of the buzz, both locally and nationally. Whatever pressing issues are occurring in the country, either from a health or an education, research or social care perspective, there is a good chance that the government will be given to address the problem. Money will be given to address the problem. Apologies. So it's worth keeping yourself in the loop about what's going on. And another way you can look for money is by subscribing to organisational newsletters. So things like NHS Future, NICE, the King's Fund, NIHR, the Health Foundation, UKRI, and there's many more. But they will send you regular updates, and I appreciate you may not want to clog up your email with too much junk, but they can be quite useful, and they do frequently provide useful information on funding opportunities that you may not otherwise be aware of. The final note on exploring funding opportunities is maybe not one for right now, but one to keep an eye on over the coming months or year. So there are strategies currently being explored about the potential to utilise crowdfunding and social finance as an opportunity to obtain funding. This is still very much in the early stages of exploration and yet to be approved and signed off. But it's something that could be available in the future. So watch this space if you're ever looking for a particular type of money. Next slide, please. Failing all that, if you have a problem and no one else can help, if you can find them, maybe you can hire the II team. So that's in the words of my reference to the A team there. We're a dedicated resource focusing on support to business cases and bids that are across Dorset ICS, often with more than one organisation involved. We can support with bids or business case development, including governance arrangements or financial review and sign off. We hold a centralised database of activity to ensure that we understand the funding streams that we are bidding for, and this is in an attempt to avoid duplication of effort and multiple applications for the same funding stream, where we've previously ended up in competition with each other. As a system, we are required to have appropriately trained people with qualification in building better cases, and the team you see here in this slide have this. We also offer a consultancy service which has two different levels of support. So one is to advise, and the second level is to co-author or contribute. So it's just worth bearing in mind if you need to reach out to us. Next slide, please. So if this is something you would like to find out more about, here are some useful links. I think you've been sent these slides in previous sessions, so you should hopefully have them. So it's just a link to a Microsoft form which requests resource from the Inward Investment team. It's a link to the Dorset transformation page, which has lots of useful tools and templates for project management, business case and bid development, and the email address where the Inward Investment team can be contacted through. Next slide, please. And as mentioned, here's a few more handy links, which include helpful websites to find funding, a stakeholder analysis tool, which can also be found on our Dorset transformation page, which was shown on the previous slide. Next slide, please. So that pretty much concludes my presentation of getting bid ready. Has anyone got any questions? As long as they're not too difficult.
Just as people think about raising their hand, huge thank you, Jo. That was really, really interesting. And we know that this is a very basic level, but is really keen or we're really, sorry, I can't get my words out, is really key when we're thinking about getting bid ready. Just thinking from what folk put in at the beginning of the chat when they were introducing themselves and what they wanted to get out of the session. Tips for bids, we've definitely had that. Understanding ways to collaborate and thinking about collaboration with regards to reducing inequalities were some things that were coming through. Have you got any ideas on collaboration, Joe, from your perspective? What's the best way of starting with that?
It's for, well, I haven't prepared anything on it, but for me, it would be very much like with the reference to the stakeholders. As you start to work through some of these bids, you will start to develop those connections with people from across organisations, and that's the best way to sort of build those collaborative pieces of work, is to kind of, yeah, to build those relationships and identify who the key stakeholders are, particularly with inequalities, because every organisation is likely to have an inequalities lead. So to get them involved in your work as early as you can, or for as many different areas of your work as you can, is going to be a key way to build those collaborations, because you'll talk about
Absolutely.
ideas, and you'll just naturally link in with each other about things that you may be working on. And yeah, so the stakeholder analysis is probably going to be your key to that, to build your collaborations.
Absolutely. I can't see any hands raised at the moment. Has anyone got any questions for Joe, or any points that they want to explore? Coming to Derek. Thanks, Derek.
Thanks, Sarah. Hi, Joe. Just a quick question about the A-Teams support service, that two-tier support that you mentioned. Is there a charge for that support?
Yes, generally. Well, it depends really. So if it's an internal piece of work, generally not, but it varies. If it's about the pot of money really. If it's a small pot of money, at my manager Catherine's discretion, she is likely to waiver that charge. But it's I think it's a 1% charge that we may apply to the funding as an overhead charge. But again, that can be discussed with Catherine. But it's important to know that we don't charge that unless the bid is successful. So if we support you through that, no charge will be applied if you don't get any money. It's not suddenly like you're gonna have to pay us for our time. It is only applied.
Thank you. And by internal, I guess you mean the likes of UHD or Dorset County or wherever?
Yes.
Yeah. All right. Thank you.
That's really helpful. Thank you for raising that, Derek. I was just thinking, you know, we're talking about getting bid ready, really being ready for an opportunity when we've got short notice for a bid. There's an awful lot to be thinking about. And one of the things that struck me with one of your slides was the point about, you know, these are small pots of money, and it was your discussion piece, small pots of money. Actually, is it appropriate to be going for that with the project you're trying to do? I get the feeling that there are a number of projects that are done on almost a wing and a prayer, that we'll get 20 grand in, we'll get 50 grand in, just to try and keep a project moving along. But I don't know that necessarily that's the most helpful way of taking a project forward when we think about that sustainability element. And you talked about the need for going for a business case, ultimately thinking about sustainability post the grant. Are there any top tips from your perspective, Joe, with regards to how we could try and avoid these scenarios?
In terms of avoid what scenarios? Sorry.
That we're limping along with small pots of money that are being put in, but actually there isn't that sustainability element.
The key thing, and I'm sure everyone on this call is feeling the pressure of, because obviously financially things are very tough at the moment. So for our organisation, your benefits are going to be the key to avoiding having to limp along with small pots of money when it comes to applying for to get something commissioned or for bigger funds. If you can prove your benefits, so you need to be thinking about them as soon as you start any project. You know, what is it you want to achieve? How are you going to know that you've achieved it? And how can you measure that so that you can prove that you've achieved it? Because that is going to be the key. The key thing that I've come across that people are looking for is, what is the benefit?
Absolutely.
So if that's the key takeaway message I could give any of you, is always be thinking about that, and value. Benefit and value are going to be your golden tickets to getting the approval that you want.
Thank you. You've got 2 questions in the chat, Joe. Just come through right at the bottom of the chat.
So what are the timescales? Timescale times for announcing? There is a bit, it really varies. You can have some that will announce and you've got months and you'll feel like this is bliss, this is heaven, I've got ages. And then you'll have one that they might be a week or 2 weeks turnaround. So yeah, and or you might not hear about it when you need to hear about it, because so it's there isn't really a, generally I would say we've usually got at least a month to work on the most of the bids that come in, but that isn't guaranteed.
Yeah.
And then if you're applying for larger bids, how should you do that? So generally with the larger bids, they come from my experience, they come from the larger organisations, NIHR or NHS England, or those types of organisations, if it's health related, but obviously other organisations will have other big funders. They have a very prescribed application form. It's very structured. They know exactly what they want to get out of the bid. There's usually a word count. It will usually come in. So the slide that I referred to, one of the first slides I did, when they'll generally ask for this information, that's the kind of structure, not rigid, but that's generally the kind of structure they will take. And that's how you would apply for the larger pots. What else have I missed? The contact details.
Yeah, we can share those, can't we? Yeah. We'll get those shared.
I think I've answered all the questions. I'm not sure if I've missed anything. If I have, please just pop your hand up.
I think you have answered them, Joe. If I may, just before we move on, just a few key takeaway messages that I've picked up in addition to the discussion we've just been having. Absolutely key to have the organisational approval, the SRO, the Senior Responsible Officer, approval and awareness, and I've personally seen that with some NIHR grants where it's a last minute thing trying to get exec sign off. You want to avoid that at every single cost. Thinking about the organisation and holding monies, and can the organisations hold monies over a financial year if that pot of money is being given. We've heard about stakeholders as well, the key priority for stakeholders, and actually making sure you've got the right people in the room. But it's also thinking about actually what are the benefits realization, what is it you're trying to do. You really must have those stakeholders in the room. We have explored a little bit, is the funding bid amount enough for the project? And then thinking about what happens post the bid, so longer term objectives beyond the funding. And again, we've looked at that a little bit. Creating a shared platform for contribution, I think, is a brilliant idea. It's something we should be doing rather than different versions. So somewhere a space, Future NHS or SharePoint, where everyone can look at that one bid together and be able to comment on. And I was really interested in this crowdfunding and the social finance. So I wonder if, Joe, we could ask yourself and the team to perhaps do another community of practice at a later date over the coming months, just thinking about, again, doing a refresh piece on this and perhaps exploring a bit more, but also understanding a bit more about crowdfunding and social finance. Just got one more before we start moving on, Joe. Just got one more point from Bianca in the chat. Are incremental innovations taken into consideration? Bianca, do you want to open mic and just explain a little bit what you mean by that, incremental innovations taken into consideration? Do you mean about the adopt and spread of?
Hello.
Hiya.
Can you hear me? Hello.
Yes, we can hear you. Yes, we can.
So what I mean is, are the founders looking, or not the founders, sorry, the ones who are investing in this kind of projects? Are they looking for something extremely new, like nothing like this on the market, or like products or services that are on the market, but you can do it in a better way or in a more profitable way?
Both. The different funders will look for both. Some will want to fund new and novel ideas and run pilots with it. Some will look for a pathway redesign or to support something that's already happening, but to make it better. So yeah, it depends on what the funder. They will have a very set idea of what they want their money to be spent on, and it could be either, depending on what they're looking to achieve.
Thank you very much.
No problem.
Thank you. And we're coming to Kate.
So very quickly, if we work, so I work in general practice primarily, and the network and PCN, sometimes we work with a charity partnership, which opens up obviously different funding avenues because they can apply for things that we can't as a organisation. Could we ask for your support with our bids if we were working in collaboration with them, but they would obviously potentially be the lead to open up that funding?
Yes, absolutely. Yeah, we
Cool.
would absolutely support that.
Thank you.
And that's really good to hear, because that really is building that collaboration, and it is exactly what Joe's been talking about. Okay, just because of time, we're just going to move on, if that's okay, and there aren't any other hands. So just any hands raised. So just before you go, briefly to say about the Dorset Innovation Hub website and email addresses. So you can contact us on Dorset Innovation Hub at nhsdorset.nhs.uk. And do have a look at our public website. We'll make the details available for you after this event, but do have a look at the public website, which has got the training opportunities, the resources, frequently asked questions, newsletters, blogs, etc. coming through. So next slide, please. Thank you. And another platform where everyone can share is Future NHS platform. So we will automatically be inviting you to join this innovation community space, which is on Future NHS if you don't already use it. You will be automatically invited. You need to actually click to join. So if you don't want to, that's absolutely fine, but the opportunity is there for you. And again, lots of different resources that we have on that innovation community space. And then next slide, please. So if we could just ask if you could complete a quick poll for us on Teams. Sandra's obviously just taken the slides down just for a minute to add that into the chat. Just asking you a couple of questions about the community of practice. So please do complete that for us. And then before you go, there's just one more element that we will want to talk to you about briefly. I just want to provide an overview on. We're just trying to find that link in the chat. Do you want to put the next slide up, or I don't know if you can? Bear with us just 2 secs. Technology's been wonderful on this Monday morning. I think Joe's got a hoarse voice because of cheering on England in the football, whoever you were supporting. And I think technology's failed us. Maybe it's feeling a bit fatigued, or we're feeling a little bit flat because England didn't bring home the trophy. But well done to Spain, and they played an amazing game. They are an absolutely phenomenal team. That's all right. That's okay. Sandra's in the same room as me, so she's just letting me know that we can't get into the evaluation. We'll send that link through to you with the email that we'll send out. And if you could, please just give us feedback. Joe, Sandra, myself and the team would really appreciate that. So final thoughts, as I've said, it's absolutely key, and just building on the points that Joe said, think about those stakeholders, really think about the benefits, and do actually think about the pot of money that you're going for. And ultimately, my takeaway message from this is, don't leave bids till the last minute. If you found something and you've only got a week or 2 weeks and you haven't really pulled together your framework of what it is you're trying to do, really think about, is this the right bid for you to go for? get yourself as ready as possible in the background so that when a bid opportunity arises, you've got your framework there. So it's about doing the work before the work to make sure that you've got the best possible chance. So huge thank yous for joining us today. We do have a drop-in session on the 24th of July at 10 a.m. That will come in the email that's sent to you. So if you'd like to join us, it's just another opportunity. It doesn't matter if there's 4 or 5 of you, it's an opportunity for you to further explore some of the questions you've been asking or other questions that may come to you. So unless there's anything else, huge thank yous. Thank you, Joe, for today, and really, really insightful. And look forward to speaking to you soon. Thanks ever so much, everyone.
Thank you. Bye-bye.
Sarah, you've got your hand raised.
No, sorry, I was just pressing the wrong button. Thanks so much.
Worry.
That was really helpful.
Thanks, Sarah. Are you able to stop recording, Sandra?